I want to welcome everybody today to Transforming Systems and Processes to Promote Connectedness. So this is the second in a series of webinars that Altarim is presenting on social isolation and loneliness, grief and bereavement. I will tell you a little bit about WellbeingTREE. WellbeingTREE is a learning and action network, and we have implemented this in the state of Michigan. This series is specific to the state of Michigan, so just for homes and social workers here in Michigan. WellbeingTREE is to teaching resilience to empower elders, and that's what we're seeking to do through this series. Altarim is presenting this with the grant from the Michigan Health Endowment Fund. And a little bit about Altarim. We are a nonprofit. We're headquartered in Ann Arbor, Michigan. And for over 75 years, we have worked with federal and state health agencies and foundations to assist and provide innovative health systems for our nation's healthcare systems. Series is specific for nursing homes, though. As Christy said, my name is Ann Hicks, and I'm here today with, I think Allison Cagle is with us, as well as our teammate Bethany Hope. And we got a shout out to Colleen Quintal, if she's there with us today and with us in spirit. Anyway, we're excited to bring this series to you. It is very unique. It is innovative. And what we are hoping to do is to learn through collaboration. So we hope to see a lot of action in the chat today. We want to hear from you. We want you to be able to share with us your thoughts and your opinions, because you know the culture within your own home, and we want to hear from you. But the purpose of the WellbeingTREE, it's to provide you with a tailored collaborative learning experience. And what we want to do through that is to use evidence-based strategies. So we hope that you're going to learn today some great evidence-based strategies to help recognize social isolation, loneliness, and grief and bereavement, and provide you with some great tools to empower you and to empower your health teams in your homes to help with the problem of social isolation, loneliness, and grief and bereavement. A little bit about grief and bereavement. As I said, this is this 5-session series is on social isolation and loneliness. We also had the pleasure of bringing Dr. Tony Miles in during our first 6 webinars on grief and bereavement, and they're very closely tied together. If you want information on the grief and bereavement series, there are recordings that are available to you. And the sessions that we're in right now will also be available by recording. Where does grief and bereavement, how does that transfer into social isolation and loneliness? What's the connection? They're each individual components. They each have their own unique identifiers, and they can be experienced not necessarily in the order of bereavement, grief, social isolation, and loneliness, but they can all be present. As far as isolation goes, people that are grieving can suffer from isolation and loneliness because of the emotions and the feelings that are associated with bereavement, that are associated with grief. There's anger. There's that feeling of pushing people away. And for our elders, there's certainly the fact that their contemporaries have passed away, perhaps their spouses, people that they've relied upon in their lives, their social circles get a little bit lonelier, their social connections get weaker. And we know that is loneliness is a real challenge for people after they've experienced loss. That can lead to depression again. In addition to that, the complications, we know that there are real physical complications that can be associated with loneliness, with isolation, and that can be a greater risk for dementia. And in addition to that, we know that we've got the dementia risk, but we've also got other associated comorbidities that respond or can be affected by social isolation and loneliness, to even the degree of like obesity and smoking. It is a potentially lethal combination in our nursing homes today. Without further ado, we would like to bring to you the Eden Alternative. Our presenters today, Christy Doan and Chris Angevine, These two community builders have got just a wonderful wealth of information to share with you during this lunchtime hour. And we know that you're going to come away with some great ideas that you can implement in your home, better understanding of what we're seeing in the residents that we're caring for, and some hopefully really good strategies that we can move forward in our person-centered care journeys to help with social isolation and loneliness in our homes. So here we have Chris Angevine and Christy Doan. Hey guys.
Thank you so much. And we are always so excited to be with you. Just want to talk a minute about some of our objectives for this session that we're going to be doing with you. We're going to be talking about the 7 domains of well-being, and we're going to hope that you get really familiar with at least 3 of them, at least 3 of the 7 domains. And also, we're going to be talking about identifying, and we hope you can identify one for yourself, some processes or current systems or practices that can really enforce loneliness and isolation when we don't even realize it. Sometimes these could be unintentional barriers. And then really kind of finding what can we do? What might prevent us from finding that companionship we desire, which we think is the antidote to loneliness, the companionship that we desire, right? Not something that someone else has picked out for us. So those are some objectives we're coming at today. And again, excited to be with you. Please blow up the chat box, comment, join in. We love it. And I'm going to turn it over to Christy to look at some growth work we set you off with at our last session.
Awesome. Thanks so much, Chris. Super excited to be with y'all. I was not in the first session, but super excited to join y'all and join Chris for this session. And I know we probably have a mix of folks who were in the last session, but maybe not, right? So we did have some growth work. It's up on your screens now. But I would also love to hear from folks who maybe didn't attend that session. We're going to do this as a chat box share out. So go ahead, you can click on the chat. It's a little like talk symbol up in the top of your screen. Would love to hear some of your feedback on these things. So what we asked you to do, those of y'all who attended last time, was to really walk through your home, walk through your community, and look at it, right, non-judgmentally, but with this curiosity around these fresh eyes. So examples, and write it down, examples of how the environment or maybe processes you have or interactions that you might have noticed, how you could see them leading to loneliness. And if you didn't have a chance to do this already, maybe just sit and think for a moment and share those answers in the chat box for us. Or if you have some beautiful stories around how y'all worked to combat loneliness, right? I worked in community over the first 2.5 years of the pandemic. And so I know that we got to be really creative around how to combat this loneliness, both for ourselves, right, as people working in this really strange, isolated time, and also for our elders or the elders that we partnered in care with, right, that had to often be confined to their rooms. They couldn't see their families in the same way that they were used to. So share any of those ideas in the chat. We would love to see them. I don't see anyone sharing just yet, so we'll keep it going. These are things I encourage you to ponder, right? Even if you didn't have a chance to do it from last time, or you don't have it. Oh, yay, we had someone. So Ryan, y'all had really one-on-one visits, checked in with them frequently, group activities, right, where you could, and trying to really bring in those staff and family involvement in it. Beautiful. Yeah, right. And we had to be real creative. We had those like plastic screens, or we used parts of our building that maybe had bigger windows than other parts. We leaned into all the technology, right? Even when we had communities or people not necessarily comfortable with it, right? Finding out what worked best for each individual was really, really important. Oh, I love it. Yeah, y'all are sharing stories about even from your neighborhood, right? And how to connect with the neighbors during that time period. Love it. Keep those going. We're going to move on with our presentation and kind of dive into those domains of well-being, but keep those coming. We love to see them. Chris.
Great. Yeah, as I went over, so these are some of the objectives we're going to look at today. I want to talk about the 7 domains of well-being. And at the Eden Alternative, we talk about well-being as a contented state of being. It's what we all desire, right? It is the ultimate outcome of a human life. We, as a organization, we got a grant. That's one of our favorite sayings. I think we got a grant, and we convened a bunch of wonderful, thoughtful, smart culture change people, and they came up together and to talk about what does well-being look like, and let's put a framework around it. So this actually is the Eden Alternative Domains of Well-being, and there's 7 of them. The first one we're going to talk about is identity. Identity is being well known, having personhood, individuality, having a wholeness, and having a history, right? Part of my identity could be many different things. Part of my identity is my clothes. I like to go shopping. I do, right? I have a large closet. It's actually a room in our house. That's a big part of my identity, is having options of clothing to wear. For some people, part of their identity is their culture, right? It's the people maybe who they've been around, who are like-minded, right? It's the community that they have around them. Maybe that's part of their identity. Some people have to be out in nature, and nature is part of their identity, right? Getting what I'm saying? So the next one we talk about after that is connectedness. And boy, does this hit in with social isolation and loneliness, obviously. So connectedness is a state of being connected, alive, belonging, engaged, involved, not detached. You could be connected to the past, the present, the future, connected to personal possessions. Maybe you're connected to a place, or as I said before, this is another one, connected to nature. So you're going to see how these domains kind of intertwine and weave in to make a life worth living, and that is that well-being. So that's really that connectedness. The next one we talk about is security. So security is freedom from doubt, anxiety, or fear. You feel safe, you feel certain, you feel assured. You have privacy, dignity, and respect. I know for me, one of the things I do at the end of the day, and I do it when I travel a lot, so I'm in a hotel room. And really the last thing I do before I go to bed is I lock my door. I lock my door, right? That gives me a sense of security and privacy. The next one we're going to talk about is autonomy. This is my favorite domain of well-being, is autonomy. I like to do what I want, when I want. I don't know if anybody else can relate to that. So autonomy is liberty, self-governance, self-determination, immunity from the arbitrary exercise of authority. That is probably my favorite statement, and really having choice and freedom. Next is meaning. So we talk about our 10 principles at the Eden Alternative. Principle number 6, meaning corrodes the human spirit. If we don't have things that we find meaningful to do, not good, not worth it. So meaning is really, we're talking about significance. It's part of things that are in your heart. Hope, import, value, purpose, reflection, things that are sacred. We attach meaning to all sorts of things. It could be an object that we attach meaning to. It could be words, phrases, people. Growth. Growth is one of our Eden Alternative domains of well-being. Having opportunities to grow, development, enrichment, unfolding, expanding, evolving. Having those opportunities. Doing things that just because you have the opportunity to do, maybe you didn't know. I mean, I got into this whole business because I went to a training that I had no idea what it was about. No idea. And I said, well, what is the training about? Sure, I'll go. And they're like, I don't know, something called Eden. And here I am, like 20 years later, right? We don't know where we're going to go in life. And that's part of growth. And the last one is joy. I think everybody can understand joy. It's really happiness, pleasure, delight, contentment, and enjoyment. So those are our 7 domains of well-being. If you actually, we are backed up by the regulations in these 7 domains of well-being. CMS actually has them. Appendix PP F679. And in there is the 7 domains of well-being. They don't mention us, and that's okay. We're excited to be in there. Is these 7 domains of well-being. So it really is backed up by that. So thank you, and thank you for all the chats in the chat box. Keep them coming. Or we sent along to you this handout. So hopefully you have this, and this is something we do to really kind of gauge how is your well-being. It's a great thing to take to other people and say, hey, you want to take a look at this and think about it. So you see all these glasses, 7 of them lined up in front of you. If you were, now you can put whatever you want in your glass. There's no judgment here. So if you were to draw a line of saying, filling that glass up with liquid, how full would each of those glasses be? Look at identity. Is it halfway full? Is it all the way full? I know for me, my connectedness is kind of low. I know because I've done this exercise. Actually sit down and do it. It's kind of interesting. Maybe then think about someone that you partner in care with. How does that look different, right? What do you need to have well-being? And if you notice one of those glasses is kind of low, might want to take a look at it, because again, when we talk about well-being, it's a balanced state of being. And we have to have all of these 7 domains kind of in some kind of balance. It's okay if something's maybe only half full. Autonomy is a tricky one. We make lots of different decisions in our life to lead to where we are. And sometimes you can't always do what you want when you want, because you've made decisions in your life that fills you in other ways. It may fill your domains of well-being in another way. But we do want to make sure that we're having some autonomy in our life, right? That's really important. Let's talk about this a little bit further, and I'm going to turn it back over to my teammate, Christy Doan, to talk about what can we do to strengthen these. Oh, and something else before I turn it over, Christy. I didn't mention here why. To think about that domain, and if it's low or if it's really full. Celebrate that. Why is it so full? And when you're working with the people that you are partnering in care with, or who are accepting support with you, and you may do this with them, this is a great way not only to talk about how full is your glass, but why is it that way? And what opportunities would you like to change that? All right, back to you, Christy.
And it truly is, a never-ending process. This is going to fluctuate depending on what's going on in your life. And I love that, Chris, you talked about that why, right? When we understand what fills us up in these different domains, we can do more of them, right? And I also love, I just got to repeat, right? Like that Chris talked about, that there may be times where we make decisions to really strengthen one of these domains, right? Really fill that cup. And it might mean that another one kind of sets aside for a minute. And we have to remember to keep going back. And so when you're thinking about this as a tool to use in your community or with your loved one, right? Like whoever you decide to think about using this with, and not just yourself, know that, again, this is an ongoing thing. And what fills somebody's cup right now, it could change. I know I experienced that over the pandemic when I got really my world became really small personally, right? And this loneliness creeped in, and my connectedness really suffered a bit. That I had to find different ways to connect with people, and it wasn't always the companionship I desired. I had to figure out what it looked like and how it looked different to fill it up. And find those. So yes, so we're going to do a couple poll questions, because I really want y'all to think about a couple of these domains, right? And I want you to think really personally about what would need to shift or maybe be added to your own personal life to strengthen your domain of meaning. So we're going to do a poll. So these are going to be different for everyone, right? Because these are individual processes. Church, time. Yeah, and you see how church got bigger? That means more than one person chose that word. So it got bigger when it came up on the screen. Relationships, stability, consistency. These are things that are meaningful in your life and help, to give that significance, that heart, right, to what you do. Intrinsic motivation, health, family time, balance, relaxation. Ooh, time is getting bigger, right? Sometimes we feel like we're running, right? And we don't feel like we can find those moments to slow it down and be present and connect, right, with the people around us, or slow it down enough to where we can find the meaning in the tasks or find time, meaning in that time with other people, outside time. These are awesome. I love it. This family time prayer. Yeah. Oh, I love it, y'all. Okay. Thank you for digging deep on that one, right? Meaning is a really powerful, and it's my favorite domain. I'm somebody where if it's a meaningless task, oh, I can procrastinate with the best of them, right? Like if it doesn't hold purpose for me, I really just don't even want it in my life. So it's important to be able to find the things that are personal for you. So let's move to the next poll. I want y'all to think about connectedness. So what would strengthen your connectedness right now? Right? So remember, this is about being well known, a sense of belonging, being engaged, involved, connecting even with your past, present, and future. This could be your work, right? Connected to your workplace, could be connectedness in your personal life. Could include nature, spirituality, all of those things. Excited to see your word clouds. Family. And sometimes that can be for each of us, right? Chosen family or, blood relation family. It really is what that personal and individual part is. Connectedness, yeah. Openness, humans and animals. Yes. Chris and I both always talk about our fur babies. We each have 3 cats and a dog. Really strange, but we both have 3 cats and a dog that are our fur babies, right? They're so meaningful, right, in our own personal lives and a huge part of our connectedness. Personal connection, nature, evening time. Oh, I love it. Acceptance. Families really standing out. Chickens. I love it. Yes. Right? So individual. Thank you for sharing. And I'm just so you know, I'm dreaming now that you have bought those little like arms that you stick on the chicken's back, and then it looks like they have these little muscle arms as they run around. Chris is looking at me like I'm crazy, but it's a thing and it's amazing.
I know what you're talking about, and I have not, but I have.
Thank you for sharing, Christy. I'm so glad. I think you should, and then send us all pictures. Okay, I digress. Beautiful, like dog, meditation, sunsets. I love it, right? How do we each strengthen that connectedness? It could even be the resources that we have. I see phone, right, on there. Time, again, as a resource. Finding those ways to find the connectedness and strengthen that domain of well-being for us. And I love, Amanda, you put in the chat, about that cup handout, even working with it with couples and spouses, and how does that show up in our relationship? I know I've done that personally with my own spouse, talking about how can we each support each other's domains of well-being, and what does that look like? And we need different things, right? I need people. So over, those first couple of years of pandemic, I was like, I love you, husband, but you're not people. Like, your husband. I need people, and so being able to have those conversations about what that means, really, really important. And so you think about the people who are accepting support from you. There's a lot of people around, but maybe that's not the connectedness or companionship that they need. So you can still be really lonely, right, in the midst of a giant, vibrant community. So finding out individually, having those conversations, becoming more well known with each and every person so that you know how to support them. Really, really important. Thank y'all for those polls. That was so wonderful.
Christy,
Yeah.
Christy, we had Amanda also had a question about using the handout with the cups. Is it something? Can they use the handouts in activities in their homes?
Please.
Yay.
Please use them. And
Great
actually, on
question,
my
Amanda.
next slide, once we move through the poll stuff, I'm going to even talk about different ways to use it and some ideas. So yes, use this tool. Thank you for catching the question, Anne. And I know the community I worked in, used to work in, we used this during our care planning. It was a simple way to talk about what people's needs are and to look at what are some of the unmet needs that we're not addressing yet. And when you say, what are your unmet needs, Chris, right? That might not compute. That's kind of like our language sometimes, right? But when we talk about the domains of well-being and we talk about how full is your cup, what things strengthen that, what things make you feel good in this area, those are really terms that are universal, right? And so, yeah, case conferences, care planning, really, really great ways to check on, again, loneliness and social isolation without necessarily saying, are you lonely today, right? Which is also not a bad question to ask. Just make sure you're ready and there to be supportive of what their answer is. And know that oftentimes folks that we have created really strong bonds with, they also want to protect us because they know that we're working real hard and we're running around like crazy. And so they don't want us to feel bad. So again, other ways to have similar conversations in your toolkit, really, really important. There's actually an entire well-being case conference method from Dr. Al Power's books, and we include it in some of our Evolve online courses. So if it's something that y'all are interested in learning more about specifically, you can check out his books, or you can check out one of our online courses that specifically takes a look at that and dives in deep around it. And this really is around how do we get from we can't do that, or oh no, that wouldn't work in our community, oh, we can't do that, to if the answer is never no, what does yes look like? Right? We get to be creative. We get to have these conversations and figure out how to meet people's needs in really fun, creative ways. And they have answers, right? So it doesn't all have to be on us. So Chris mentioned early on to the barriers. So we're going to dive into those barriers a little bit more, and we're going to ask y'all to think a little bit about it as well, what those barriers might be. But we'll go first. I'll kick it over to Chris.
Thank you. Great discussion. I love it. Yeah, those, when you have those word clouds and word pools, they really get such wonderful conversation going on. Easy way to do that. We often use Mentimeter. So if you're curious and want to do that for your community, just a tool we're shooting out at you. It's free, www.menti.com. And it's a way to do word clouds and things like that. We found it along the way. So I just thought I'd pop that out at you. I'm sure Christy's about to put that in the chat box. Another thing I wanted to mention before I get into this slide is that we also have well-being assessments at the Eden Alternative. We would love to share with you. It is just an easy, I believe it's a 2-page well-being assessment that really is a great base to check on. This may be something you can do. Maybe you want to do it for like a one-time assessment and just see what's up, right? This could be a comparative, right? You could do this to pre and post change. Like, where are we right now with our well-being? Okay, now we're really going to work. We've learned about these domains of well-being. We're going to be implementing them and looking in different ways to use that. So then after you put some great time in it, you may come up with a great system or a plan where you've involved so many people to figure out how to fill up our cups of domain. That would be, it's definitely a great workforce development, staff retention, and for the people that live there, wow, what a great way to look at well-being. You can do all this work around it, and then you're going to take the well-being assessment again and say, all right, did anything change, right? So yeah, it could be used in different ways. If anybody's curious about that, we would love to get you that information. So we do have some well-being assessments. I just wanted to mention that. Switching gears a little bit, not that much, we're going to, again, talk about some, as Christy mentioned, some unintentional barriers. But to really talk about that, let's look at a couple different things. So in this slide, I think you can see the difference between the three. This first one is really that institutional model. It's the medical model that we kind of work towards changing. Well, we do work towards changing, right? Because in this first picture where you can see everything is concerned about the institution, right? What drives us. It could be the way we word our job descriptions. It could be so many things, but it's all based on what's good for the institution, right? What's good for our census? What's good for our bottom line, right? What's the most efficient way to get things done? Maybe not the most effective, but the most efficient, right? It puts the medical model as the star of the show, right? When, we know in another one of these, which would be the other one, person directed, is that people are the star of the shows. So we had an institutional model. And again, this is the system we've been given. I want everybody to please hear that loud and clear. This isn't about people. It's about systems. And so we've been given these systems, this institutional model, medical model, and we've been taught to work in it. And sometimes we've created our own monsters because of it. We've created different barriers that this supports this institutional model, but also boxes us in. So the next thing, we got a little bit better and we started talking about person-centered. And person-centered is great because, well, we're talking about all of us, what's best for the person. So yes, that person's in the center. So that's better. But one of the issues with that is that we could unintentionally do what we think is best for the person and not really listen to what they need. So in a person-directed model, everybody is involved. You have conversations going both ways. We really talk about good communication. And there is a responsibility for communication, not just on the sender, but also on the receiver. So how are we listening to each other and going back and forth? So that's really what we want when we talk about a person-directed care approach. So again, some of these unintentional barriers. What are some systems, processes, practices that have really stepped up and can get into our way of person-directed care and can affect social isolation and loneliness? So what do you think of when you think about your job descriptions? What does your job description speak about? What is the first, if you look at your job description, what does number 1, 2, and 3 say? Does it say things about getting a task done? Or does it talk about building relationships and building community? Because whatever we're putting first is what we're saying is most important. That's what people are reading first, right? So I'm looking at my job description. Okay, and you always got that lift 50 pounds. That's always in there. You got to lift 50 pounds somehow everywhere. But the ones I'm going to be, if I'm a housekeeper, it's going to talk about doing the deep cleans and different room cleans. And I may be cleaning offices and just different, staying to the sanitization process. I don't know if that came out right, that the organization uses, right? So instead, we can list those things, but they can be later on. What if we talk about building relationships? What if we talk about the first thing that is important in your job is getting to know your fellow teammates and the people who live there, where you work. That's some of the first things we need to build relationships. So to follow up with the job descriptions, how are we evaluating people? If, again, the first thing on a performance evaluation is tasks, we're missing the boat. If we talk to people about the relationships they have built, when we're talking about areas that people want to grow in, do we have growth goals on performance evaluations? Are we talking about areas that people want to grow in, right? Because again, even if we talk about isolation and loneliness of the people who live in an organization, but there can also be isolation and loneliness of staff. How are we as leaders and organizations providing time for people to get to know each other? If we're talking about person-directed care, how are we doing that? If we think deep knowing relationships are the hallmark of that, how are we helping people get to know each other and providing opportunities for that? Okay. So another thing might be our care planning. What are we doing in our care planning? Are we using things coming from in the I statements, right? Are we using strength-based language versus kind of that deficit or focused on problem language? How is that looking? So if we're putting the person, if we're always looking at person in their deficits or their disease, again, we're missing the boat. So how can that look different? The same with care conferences. Who is involved in those care conferences? Right? If we want to make sure that we know the best and we know the best about people, their well-being, what needs they might want, in order to feel full with connectedness and meaning and to feel like their life is worth living, who is involved in that care conference? I just taught a training last week and I had a bunch of housekeepers in the room. Housekeepers should be at care conferences. They know so much. They are in that person's room, and guess what? They're not asking that person to do anything. They're building a relationship with that person. They don't have to ask them to take a shower, to take their medicine. They're actually building relationships with them.
Routines, right? Where are those time stealers in our our daily approach? And by time stealers, I mean those things that take us away from building a relationship with the elders, with the residents who live there. Are there what processes do we literally and unintentionally, but literally have in place that keep it from creating meaningful connections? Right? Are we so focused on lunches at this time and we have to get everybody down by a certain time, or we have a get up list, right? And we have this many people that have to get up by a certain time. Whew, versus building those really deep knowing relationships with the residents, with the elders, finding out what their daily rhythm looks like and how do we fit in with that. I know that can feel really scary where you're like, we will get nothing done. I promise you that's not true. I promise you that there are rhythms of daily life that can actually make everyone's well-being feel a whole lot better and decrease loneliness, right? Because I'm not just going in as a nurse to say, hey, Chris, here's your medication. It's, 12:30. Let's go, or finding Chris at her lunch table where all of her friends are, where they're enjoying their time and they've got this beautiful convivium, right? They're connecting. And here I am coming and bringing medication and interrupting this beautiful moment of connectedness, right? So really thinking about what do those routines look like, and what policies do we maybe have in place or expectations based on your leadership in your organization that then translate out to those routines, right? Really, really important to know about your leadership and how they affect culture of your organization. And Amanda, you said most resident concerns we get notified about come through our housekeeping and dining staff. Absolutely, right? These are people that have meaningful and deep connections with. And so what if it wasn't always, the approach from the clinical staff, right? Wasn't always asking them to do something. I love how Chris framed that, not like, all right, it's your shower time, let's go, right? And stripping naked and rolling them down a hallway in a chair versus, hey, it is your shower day, starting with a conversation. What does this look like? And I'm not saying that y'all do that all the time. And I know it happens because I've seen it in my own community, right? That was actively working on that we can get caught up in those routines and get caught up in the task and caught up in the worry about we have to get all of these things done. So what does it look like when we work to change and shift the culture in that way? And staffing, right? Loneliness and all of these domains of well-being, they are so easily translated, right? It's the same for our staff, for our employees, or the elders and residents who live there. And so when we approach our staff in the way that has that same grace and that same understanding of how do we make sure their needs are being met, both in personal life and at work, right? Super important. And so we can have, I mentioned, the performance evaluations. We can talk about the domains of well-being with the staff too, right? And approaching that staffing piece, right? If someone calls in, right, and they've got a childcare issue, and they're met with a response of, oh my gosh, it's an hour before shift. Don't you know the policy around you have to call in at least 3 hours before, and I don't know how I'm gonna, handle this now. That's really isolating, right? And doesn't feel very good and isn't person directed. Versus that compassionate approach, that really person directed approach to find, hey, wow, I'm so sorry to hear about that. Is this something that happens often? Like, how can we help support you? Is there another resource we can have? Or, hey, I need to find coverage right now, but let me call you back, and make sure everything's okay. When we approach things with a compassionate lens, I promise you, you don't get walked all over. Because that's one of the things Chris and I hear often in our trainings is, well, if we gave grace to everyone, everyone's going to take a mile, right? And are you going to have those one-offs? Sure. But is it going to happen all the time? No. Same with your elders, right? I think I went off on a little soapbox on that, but anyway, love this stuff. So again, looking at and having a conversation, I challenge y'all to take this back to your communities to kind of say, what are some of these unintentional barriers that we have? And without judgment, right? Be curious. Say, I wonder what we have in place. I wonder what we could shift. What would people be interested in shifting? And Michelle said, one thing you like to address at orientation is reviewing that we all work in someone's home. Yes. And that all of you, right, are involved in that partnership of care. I love that. I love that. And yeah, sometimes because of its work, we forget that it's their home.
Yeah, I was thinking, looking at these, Christy, that there is a couple more that we don't have on the slide, but really, how are we advertising? How are we putting out that we want to hire people? What does that look like? What are we asking for? Are we asking for people to be good at tasks, or are we asking them to be compassionate relationship builders? And I love that you said orientation, because how are we interviewing people? What are we interviewing for? Right? All those kind of come into play for setting the tone of the culture that you want and climate that you want for your organization. All of them come into play. And one thing I was thinking about staffing as well is these consistent assignments. I don't know if that was mentioned, Christy. I don't think so. But really having the same people work with the same people, right? When we talk about these deep knowing relationships, as best as you can. I know we have people, we used to call them floats. I'm sorry, but we did. Floats, right? We have people who floated around the building. Now, why can't we have the floats float to the same group of people all the time? We were a very large organization. So we had a centralized staffing that I was trying to change like nobody's business. But the centralized staffer would just send these floats wherever, right? Why not send the same people to the same neighborhood or households? So even like a per diem can still have that opportunity to build relationships. So how do we look at these systems and processes and practices that we have? And if the elder or the person receiving support is at the center, in the middle of everything we do, how are we stepping back and evaluating how we're making decisions? Who's involved, right? To get to the best processes and practices that we can have for person-directed care, and really having that address loneliness and isolation. And we know it does. Really taking a step back and looking at what you're focusing on. So thank you. And I'll put back over to Christy. I think she's going to work on a little chat box discussion here.
Yeah, would love to hear from y'all. I love all the conversation about, oh yeah, bringing these folks in and this is what we do. I love the conversation. Keep these going. I would love to see if anything has kind of popped up for y'all, right? I did the little challenge earlier to take a minute and kind of think about, what are some of these unintentional barriers that you might have in your community? So I want to hear, what are 1 to 2 barriers that y'all have in your community, in your home, of people being able to find that companionship that they desire? And if you have any ideas, what could be a way? And then what are some ideas, or what are some creative ways that you might be able to address this? Or what group, right, would be the people to reach out to figure out what would be the next step. What's the next right answer? What would we want to take a look at? A great example, is that task doing versus relationship building. So, and that spreads out to all things, right? This could be med pass. This could be shower time. This could be, again, dining rooms, right? Is there time to linger and socialize? Do you have people waiting in a line to enter your dining room before the dining room opens, right? And everyone has to wait until the exact time when the doors open. How could you shift that, right? To be a socialization half an hour, right? That then leads into this beautiful connection over food where we break bread together. We're slowing down the pace. How do we move around? How do we make sure not to outpace the people that we're talking with, the people that we're engaging with? Rhonda had a berry for us is the tendency of staff to draw comfort from each other and then focus on talking to each other and not the residents that may be in that same space. Yeah. Oh, right. And so then you think about and they're watching too, right? So you've got staff providing this beautiful relationship, this beautiful comfort, and these people who live there watching and not receiving that same, or have the opportunity to give, right? Giving and receiving that comfort and that care. Oh, thank you for being willing to lean into that one.
I wanted to address something I saw in the chat box while people are still thinking about these questions. But I hear you, and it was Rhonda. That it can be challenging to keep the CNAs and housekeepings included in the care plannings, but they know so much. So I remember when I first got into this field, in a care planning conference or whatever it might be, if the doctor walked in, everybody stopped and everybody gave the doctor all their attention, no matter what we were talking about. So the doctor could say what they want and get on his busy way. Now, I'd like to flip that. And when a CNA walks in, who is so important, that we stop what we're talking about as professionals, right? Social worker, dietitian, whatever it may be. And we give that CNA all our attention because she has important work to do. And then the CNA can get back to doing the fabulous, important work that they do. And like same with the housekeeper, they don't have to be there through the whole thing, but having them there, having some pointed questions, obviously some education. Education is the antidote to fear. So if they know what they're expected to do in a care conference, they can come in, do their thing, and head out and be who they're supposed to be with, right? Which is the people that are accepting support from them. So just a thought on that.
Oh, I love it. I love it. I love it. All right, I wish we could just keep going on this. Let's talk a little bit about your growth work. What we hope for y'all to take away from this, other than the handout, right? But we really want, again, y'all to go back to your home, back to your community, look at it non-judgmentally. Don't take it personally, right? This is just coming in with fresh eyes, with a non-judgmental look. And the breakout room, we were kind of talking about this chat box. That's what we meant, right? So this idea of what are some of these unintentional barriers? Take that thought and dive a little deeper. Take a look at it with your community and acknowledge what's going well. Right? Be strength-based with your own approach to this. So what are we doing really, really well to address these unintentional barriers or these processes, these policies that keep people from connecting, that keep people lonely, right? Because they can't connect with each other. And then where are the opportunities to do this differently, to be better in overcoming the loneliness or changing or shifting those processes to bring in and invite in the connection and the deep well-knowing, deep knowing. There we go. Deep knowing of each other, right? Connection and finding the companionship that they desire. And each session too, you'll see that we have the quote by DeWitt Jones. He is an amazing Nat Geo photographer, has an incredible video called Everyday Creativity. And he also has great quotes. His thing, right, is I am not afraid of making mistakes. I'm just looking for the next right answer, right? So if there are no mistakes, what are those next right answers? And there's no one answer. It opens up, right, this possibility of being able to be creative and be, and be excited to figure out what the next right answer could be. And that's when you bring all the people around. So that's it for our Eden alternative portion of today's session. We are so thankful that y'all had us.
Take care, everybody.